Feeling the ground underneath, slowing it down. There we go. And then shake.
Trauma release exercises, or TRE, is a form of therapy used to assist the body in releasing deep muscular patterns of stress and trauma. The exercises may activate shaking or vibrating in the body, which in turn calms the nervous system. Sally Jessamine is one of a few TRE therapists practicing in the Lower Mainland. Jessamine worked as a nurse for over 25 years. However, she decided to hang up her scrubs and help the people in a different way.
My role with TRE, I'm an instructor for the trauma release exercises. I teach individuals one-to-one sessions, or I'm also teaching small groups. My background has been nursing for a number of years, over 25. I don't even want to say that, but and I've always been interested in holistic health and healing and new modalities for people to, and for myself and others to heal themselves. And that's why I'm really excited about the trauma release exercises, is that you can do them yourself. They're very simple. They actually don't need equipment, and you don't need a practitioner to go to. Once you learn these exercises, you're able to practice them yourself. But this is the one, not quite as relaxing, but since you play, it's a wall sit, yeah. So you want to have your feet way out, because you don't, if you're in, you're going to have strain on your knees. So here, you want it way out. Coming down to where you want to feel about a 5 in the quads. I know you're quite strong, right? And if it's, yeah. And then you can lift your heels off of the mat if that's possible, yeah? And that gives you a little bit more challenge, no? Okay. Are you okay with that? Yeah. Okay. And breathe. And if you get tired with that, come down and just sit against the wall. This is just your extra because you're a soccer player. Generally, we just go like that with a flat. Yeah. So it's going to be for a few minutes. Okay. Yeah. So just be aware. Okay. And so when you get tired, you may feel a bit shaky. You may feel some heat. You may feel other sensations. Just be aware, and if you're comfortable with it, then you just stay with it.
Brittany Hoffman is a registered counselor who helps people overcome trauma. Hoffman practices a traditional approach to treating trauma using verbal therapy. Although she believes alternative forms of therapy may be beneficial, she says a combination of different kinds of therapy is ideal.
I don't think I'm in any place to say that my way is the best way. It's the way that I've found most effective, but it might not work for everybody, and some people might not feel safe sitting in a room talking to someone that they don't know about these things. My fear with not doing talk therapy would be that there are parts of the person that they are just maybe avoiding or covering up and are trying to find another way to deal with it without actually dealing with those emotions that happened.
With more and more non-traditional approaches of treating trauma emerging, Jessamine has this to say to those who don't believe in TRE.
And then push up through the back of your foot, through your heel. Well, they don't have to believe. That's okay. I think experiencing is believing. So before somebody's going to naysay it, I say come and have a session. Try it and see how you feel afterwards. If you feel a benefit afterwards, maybe you'll change your mind. We are just stressing the muscles, and we're going to initiate the really natural trauma, neurogenic tremoring. This is just starting at the feet, and then we're going to go to the calf muscle next. Yeah. Feeling the ground underneath, slowing it down. There we go, and then shake.